Welcome to Chillin' 101. We hope this video helps.
You start by confirming the inhaler is the correct one and in date. This prevents wasted doses and ensures medication potency. Once done, wash your hands, remove the cap, and shake the device for 5 to 10 seconds to mix contents properly. If the inhaler is new or unused for more than 2 weeks, prime it with 1 to 4 sprays away from your face. This guarantees an accurate dose on first use. Make sure the mouthpiece is clean before moving on. You want to exhale fully away from the inhaler to create room for the incoming dose. This helps the medicine reach deep airways. Next, place the mouthpiece between your teeth and seal your lips, or use a spacer for better delivery. Press the canister once while starting a slow, steady inhalation. Timing is key so the spray enters as you breathe in. Once you've inhaled, hold your breath for about 10 seconds or as long as comfortable to allow deposition, then exhale gently. You finish by replacing the cap, and if the medication contains a steroid, rinse and spit to reduce oral thrush risk. This protects your mouth and throat. Next, note the dose taken or check the counter and store the inhaler at room temperature away from direct heat to preserve effectiveness. If you don't feel the spray or see no mist, check for a clogged nozzle, shake, and reprime, or confirm it hasn't expired. This troubleshooting step fixes most delivery problems quickly.
Thanks for watching. Consider subscribing if we helped you.